anatomy of the horse's lower limb or foot essentially is on the outside you have the actual hoof wall itself. This structure right here at the origin, the juncture of the skin, is called the coronary band. You can see it as we pull this up. This is coronary band right here. And of course, structurally this is known as the pastern, the fetlock, cannon bone, and suspensory tendon, and then up to the horse's knee. Now, internally, what we're looking at here is, this is the actual coffin bone itself. It's called the coffin bone because it's encased inside the hoof wall itself. And of course, this is a transverse section, meaning that it goes right down through the middle of the foot. And this joint right here is the coffin joint. Okay, attach this short pastern to the coffin bone itself. Here's the extensor tendon that attaches right on the front, this pink structure right here, right below. And along this base of the coffin bone here, this is a deep flexor tendon that goes down the back. And right here, we have the navicular bone. The navicular bone is a long, flat bone that goes right across the foot that sits back, that is right here at the juncture of both the pastern and the coffin bone, and it is where the deep flexor tendon runs across here. So it's kind of like a bridge or a junction to this area. Now back here, we go further up, we have the pastern that's slightly encased in here as well. The second pastern, and the long pastern joint is above here. And then of course we have the suspensory ligaments that come along here. The distal sesamoidian ligaments is what they're called at this juncture. And of course here's the suspensory up in here. And essentially this area is a large component in lameness as far as coffin joint arthritis. If you get arthritis in this area, it's very, very significant. You usually get a big spur here and a lot of exostosis or some extra bony growth here. The navicular itself in this area can be a big problem from a number of different standpoints. If the foot becomes contracted or it's a very, very small horse, has a big body, it gets a lot of pressure and can deteriorate quite rapidly due to the amount of pressure put onto it for the size of the animal. So this is an area of arthritis and chronic lameness problems in a lot of horses as they get older. The coffin joint can be in young horses, especially race horses early on, and can happen in any horse at any time. Pastern joint arthritis is not usually as complicated and happen as many horses, but fetlock arthritis is real complicated, and you see it in quite a bit of as far as like race horses or performance horses are concerned.
We hear a lot about ring bone. Where would ring bone fit into this scenario?
Well, ring bone is essentially isolated to the lower two joints in the foot. It's between the long pastern and the short pastern right here. This area would be an area known as high ring bone. Mm-hmm. Okay, and if a horse gets some exostosis or extra calcium built up where you can see it visibly in the coffin joint and the short pastern, this is low ring bone or coffin joint arthritis. So pastern arthritis or high ring bone, coffin joint arthritis is low ring bone. The reason we call ring bone is because externally you can see an area where the calcium buildup is in this area, so you know it's high ring bone. Or if it occurs right above the coronary band in this area, it's called low ring bone.